Welcome to Dentistry online channel, a platform to learn dentistry. Today our topic of discussion is oral submucous fibrosis.
So what is oral submucous fibrosis? Oral submucous fibrosis is a chronic debilitating disease of the oral cavity, characterized by inflammation and progressive fibrosis. Now the epidemiology of oral submucous fibrosis. It is common in Southeast Asia countries, India, Pakistan, Bangladesh, Bhutan, Nepal. Now the etiology of oral submucous fibrosis. Local factors causing oral submucous fibrosis are chilies, areca nut or betel nut lime, and tobacco chewing. Systemic factors causing OSF are nutritional deficiencies, genetic predisposition, and autoimmunity.
Now the pathogenesis of OSF. Areca nut is the main irritant of mucosa which causes OSF. The pathogenesis of oral submucous fibrosis is hypothesized to involve the disruption of collagen metabolism by components of the areca nut. Areca nut has alkaloids, flavonoids, and copper. Alkaloid stimulates fibroblast and gene expression which stimulates increased production of collagen in mucosa. Flavonoids are responsible for cross-linking of collagen, which becomes resistant to collagenase, and degradation of collagen does not occur. Copper upregulates lysyl oxidase, which is an enzyme involved in collagen cross-linking. This process renders collagen fibrils resistant to degradation by collagenase. Production of collagen and fibrin, and resistance of degradation of collagen causes oral submucous fibrosis in mucosa and muscles.
Clinical features of OSF are trismus or inability to open mouth, stomatopyrosis, due to which generalized oral burning sensation occurs. Vesicles may erupt. Next is peachy eye, pigmentation of oral mucosa such as melanosis, dry mouth known as xerostomia, stiffness of mucosa, and blotchy and marble-like palamucosa, leukoplakia of mucosa. Oral submucous fibrosis is characterized by juxtaepithelial and submucosal deposition, a densely collagenized, hypovascular, connective tissue, with variable numbers of chronic inflammatory cells. Epithelial changes include subepithelial vesicles in early lesions, and hyperkeratosis with marked epithelial atrophy in older lesions. Treatment of oral submucous fibrosis includes conservative therapy and surgical therapy. Conservative therapy includes physical therapy and medical therapy. Physical therapy includes various physical exercise regimen to increase mouth opening, splints, and other mouth opening devices, such as TheraBite, microwave diathermy for increasing mouth opening in mild cases. Medical therapy includes drugs, which are responsible for modulation of inflammation and immunity, promotion of blood flow, antioxidants, nutrients, and micronutrients therapy, fibrinolytic therapy, and various other drugs. Drugs which causes modulation of inflammation and immunity are steroids, interferon gamma, immunized milk, placental extracts, levamisole, and colchicine. Drugs causing promotion of blood flow in OSF are pentoxifylline, buflomedyl hydrochloride, and nilidrin. Drugs in antioxidants, nutrients, and micronutrients therapy are beta-carotene, lycopene, T pigments, vitamins, and mineral supplements. Fibrinolytic therapy drugs are hyaluronidase, chymotrypsin, and collagenase. Other drugs which can be given for treatment of mild cases of OSF are anti-tumor growth factor beta drugs, copper chelators, bornol, garlic extracts, aloe vera, and turmeric. Now the surgical therapy which is used for moderate to severe OSMF cases. In surgical therapy, fibrotomy of fibrous bands is done with the help of scalpel blade or laser. After fibrotomy, remaining mucosa is covered with flaps, which can be extraoral flaps, intraoral flaps, microvascular free flaps, or allografts. Extraoral flaps used after fibrotomy are split thickness skin graft. Superficial temporal fascia pedicled flap. Temporalis pedicled flap. Nasolabial flap. Platysma myocutaneous muscular flap. Intraoral flaps are tongue flap. Palatal island flap. Buccal fat pad. Microvascular free flaps includes radial forearm flap and anterolateral thigh flap. Allografts includes collagen membrane and alloderm. That's it for oral submucous fibrosis. Thanks for listening. Don't forget to subscribe our channels on YouTube, Facebook and Instagram. For more lectures visit Dentistry online channels. Take care.